Hi there. We still have 1 more minute, so I'm just waiting for everybody to join. Hi. Nice to have you all here. Hope your Christmas preparations are going good and ready to, enjoy the season and the blessings and ready for a happy new year. So we'll see. Hi. Hi there. So good to see you all. And I know there are lots of people who couldn't make it today, but just don't worry. Okay, we will have this recorded, so you will get it. All right. You guys can hear me, right? You can hear me? I know you guys are saying, hey, hi, ma'am, we're just, yes, okay, just making sure. All right, so I guess we will start then, okay? We will be doing something different from today. Different in the sense, different topic, and this is something which has been requested from everywhere. Actually, many students requested to pick out some of the key drugs which are commonly asked in NCLEX RN, and I think pharmacology is something very difficult for most of the people. So I just wanted to kind of pick up some important drugs which I think are important, and why I think so is because I talked to the students who actually had taken the exams, and from the feedback, and these are some of the drugs which I think is mostly asked, or some aspects of it. So we are not going to cover everything today. I mean, there's lots of drugs which I really want to, which I have identified. So it's going to be many parts, and today we will start this series. We will have this, first one today, and then we will continue to do it throughout. And actually, after today's webinar, we will be closed. Like next week, it's Christmas holidays. So next week and the next week. So next 2 weeks, we will not have live webinar because it's Christmas, New Year holidays. And many people requested me that they are not here, and we are also planning to have some travel, so we will be closed. So the next webinar is going to be in 2019, January 1st week. Okay, so but we will be continuing the pharmacology from January 2. So I'm just starting it today, and we will be continuing it throughout. All right, guys. So I guess most of the people who are here, and I know maybe at least like 25% of the people are here who can come live, and for the rest of the 75%, you will see me again. All right. Okay. So let's start. The first one I want to talk about is corticosteroids, and corticosteroids. Some of the most common ones which are asked are these four ones. Methylprednisolone, you might see prednisolone, you might see methylprednisolone. So either way, it's a corticosteroid. At least by seeing the name of the medicine, understand that this is a corticosteroid. Methylprednisolone, then betamethasone, okay, hydrocortisone, and fluticasone. So you can imagine. So the last, the letters are like on, like one, prednisolone, fluticasone, hydrocortisone, betamethasone. So whenever you see those kind of ending, at least remember that, okay, this is a corticosteroids. And for all the corticosteroids, most of your management, or what you should be looking for, or what is very important for you to know, are going to be the same. See, for pharmacology, the only way to tackle pharmacology is by grouping them. Okay, it is not possible to learn each and every drug, all the signs and symptoms of where it is used, and all the management, and all the adverse effects and side effects, and nurse's role for each and every medicine. It's going to be very hard to remember them. I mean, it is possible to learn. Okay, it is possible to learn like that, but on a short span of time where you are going to read the exam, it is going to be very difficult for you to probably remember everything. And that's why many students have such they are frustrated when it comes to pharmacology. And that's why I think the better way to learn is group them together. So if you know how to take care of this group of medicine, I mean, these are the common side effects for this group, and this is the things I should be looking for in this group. And if I can match one, name of the medicine to this group, I will be okay. So that's how you should be learning pharmacology. Don't try to, learn each or remember each and every drug. I mean, you will spend considerable amount of time in that, first of all. Second, you will be frustrated when you cannot remember exactly what's going on. Okay, so the only way, I mean, there is memorization. You have to memorize the names, but at least try to group them into something of a bigger area. Like, if you see anything which ends in zone, okay, like prednisolone, fluticasone, hydrocortisone, betamethasone. From the name itself, you can group it into corticosteroids. And now we are going to talk about corticosteroids. So anytime you see a corticosteroid, you know what is the most important thing you should be looking for. We are going. I have identified some of them, and I'm going to let you know, because this is not from any book. This is from my, from my entire teaching experience. I guess I just came up with these webinar series, so it's going to be really helpful for you. Okay, now as you already know, and only the comprehensive and premium students are here. So as you know, we discuss the medications system-wise after each system in your comprehensive course or your premium course, right? So you have to look into that, listen to it, but this is on top of it. Like, this is like, I just identify the ones which are commonly asked in exams on these days. So I'm hoping that if you get a question from pharmacology, it's going to be something from here. So it will be helpful for you. Okay. All right. So steroids, the major thing I want you to remember about steroids is side effects. First is immunosuppression. Second is hyperglycemia. Those are the two major side effects which usually, you have to look for, or the major in the sense, those are the ones who are acute. Like, there are long-term complications, but these are the two which are very acute and which you can see at the bedside most of the time. So you have to be very careful about these two things: immunosuppression, hyperglycemia. Okay. The third thing you are going to see is fluid retention and weight gain. Because corticosteroids are really good medicine, and we know that anytime we don't know what's going on, like an autoimmune disease, our choice of drug is corticosteroids, right? And anytime there is an inflammation which cannot be handled by any other medication, our choice is corticosteroids. When there is pulmonary edema, we give corticosteroids. When there is a heart problem, we might give corticosteroids. When there is sepsis or anything which is we cannot handle, we give corticosteroids. So, but we have to be very thankful for this medicine. But the problem is there is a lot of side effect. So it's always, what is the risk? What is the benefit? Is it good? Is it bad? I mean, that's how you are going to choose it. And you have to monitor. And in that, immunosuppression, hyperglycemia, fluid retention and weight gain are the ones which you are going to monitor on a continuous basis at the bedside when the patient is in acute hospital. Now, there are long-term effects too. We will talk about that. But remember this: immunosuppression, hyperglycemia, fluid retention and weight gain. Now, that makes sense, because anytime there is fluid retention, you are going to have a weight gain. Okay. Anytime there is hyperglycemia, your blood sugar is going to go up. Right? And so you have to be very careful when there is a diabetic patient receiving, corticosteroids, because diabetic patients might need additional insulin, and we talk about sliding scale insulin in endocrine system. So they will need additional insulin, sliding scale insulin, whenever there is, these corticosteroids are used on an acute basis. And sometimes we give it IV, right? I mean, somebody is in hospital, we give corticosteroids IV, so we might increase their blood sugar really, really fast. And you might have experienced that. Many people have this problem. And on top of that, when there is a stress, automatically your body is going to produce more, sugar, so it's going to go up. Okay. So immunosuppression. Now, what are we going to do about immunosuppression? I will tell you about that. Hyperglycemia, fluid retention, weight gain. Remember these four major things. Now going into a little bit of long-term complication is one is your eyes. We don't talk about this much, but I want you to remember that corticosteroids can cause cataract. Okay, corticosteroids in the sense long-term use of corticosteroids. Now look at this. Who is going to take hydrocortisone for a long time or methylprednisolone for a long time? People who have arthritis, people who have autoimmune diseases like systemic lupus erythematosus or anything for that matter, any autoimmune diseases, they are going to take corticosteroids for a long time. People who have endocrine disorders are going to take corticosteroids. People who have recurring COPD, they might be like what we call a frequent flyer. They have this pneumonia episode, or they have this shortness of breath episode, or an inflammatory process which is going on again and again, every month, every 2 months, and they are admitted in the hospital, and then we treat them with IV steroids, right? So the people who are going to take it for a long time, and fluticasone, remember this one, fluticasone, it is an inhaler. Okay, it's something which is used by people who have breathing difficulties like COPD or asthma or any kind of breathing difficulties. Even kids use fluticasone. So it's a steroid inhalation. So you have to kind of be careful with it, and many parents may not even know that there is a steroid component in it. They will just say, oh, this is just an inhaler for my baby to breathe better. So let me just give an additional 2 puffs just to make sure. But there's a lot of dangerous things attached to it because they don't understand this is a steroid medicine, even though it is very lower dose, and even though it is not going to be too much into systemic circulation like an IV, because you are inhaling it, it's going to directly go into the trachea, bronchi, and the lungs. But still, it's a steroid, right? So you have to be careful about that. And another thing is the long-term problem other than cataract is osteoporosis. So osteoporosis and muscle weakness. I mean, you get so much of muscle weakness, and osteoporosis is when you have these spongy bones, I would say, that they are going to break so easily. Okay, so you should be keeping them on for precautions. Very important to keep them on for precautions, because when somebody is taking steroids, long-term steroids, there is always a chance that they are going to develop osteoporosis. So you should be very careful from preventing that fall so they won't have that fracture, okay, and the muscle weakness too. And lastly, but not least, it's the food. It's the gastric irritation. So it's in gastric irritation, you have to take it with food to avoid gastric irritation, to avoid ulcers from forming. Every time you give steroids, we are talking about PO, okay? IV, it's different way because it's not going to go to the stomach. When you give IV steroids, it's going to go into the systemic circulation directly. It is not getting absorbed from the stomach, right? But if you're giving a PO medicine, the steroid tablet, it has to be taken with food, okay? It's always better to take it with food because of gastric irritation. Now, what happens if you don't take it with food is because the irritation can cause ulcers. Okay, you can get gastric ulcer, and when there is gastric ulcer, it can bleed, and that will lead to GI bleed. Please remember that steroids can lead to GI bleed, and when there is GI bleed, it can be lower GI bleed or upper GI bleed. Mostly it's lower GI bleed, and people may not even realize that they are having a lower GI bleed, because honestly, how many of you look into your bowel movement every morning? I don't think so, right? So how are you going to see the color? I mean, we learn that there is black tarry stool or there is blood, we are worried, but how many people know about that? How many people actually observe for that? They won't even know until it is too late and they are feeling dizzy, they are falling down, they cannot change their position, they feel dizzy. By the way, that's called orthostatic hypotension. So, and they check the blood, hemoglobin level, and it's all the way down. And that's when the doctor is thinking, oh, by the way, what medicine are you taking? Do you take it with food? Do you have ulcer? Do you notice any kind of black tarry stools? Or maybe you're bleeding there, so that's how we find out. So very important to remember these points about corticosteroids, okay? And there are somebody's asking, Jaren is asking, so fluticasone is given by AS. Fluticasone is the commonly used inhaler for people, okay, for people with breathing difficulties. Okay. Now, some more important notes about steroids is do not discontinue abruptly. I think that's one thing everybody knows, right? You are supposed to taper the dose of steroids. You cannot stop it all of a sudden, because if you do that, you are going to do more harm to the body, and the endocrine system is going to be in trouble, and that's going to be, there can be problems like Addison's disease or crisis, where you have problems with the amount of steroids in your body. And steroids are important for you to live, so you cannot just discontinue abruptly. You will always taper it down. And if you look at the doctor's orders for steroids, you will see that mostly they will say, okay, take one tablet in the morning and one tablet in the noon time, one tablet at bedtime. And then they will say, okay, now after 1 week, take only in the morning and the night. And then after that, they will say, take only once a day. And then slowly they reduce the amount or the dosage, and then you stop. So that is called tapering the dose. Okay, taper it down. Do not discontinue abruptly. Now remember, this is also true in case of your inhaler. Okay, if you have been taking the fluticasone inhaler 2 puffs, and doctor might say, now you can reduce it into 1 puff, and that's how you stop it. I mean, if you have to stop it. But sometimes people have to take it because of their really bad, shortness of breath. Okay. And report any signs and symptoms of infection to the healthcare provider immediately. Now remember, NCLEX is not going to tell you that this patient has infection. Okay, NCLEX has special way of telling you or giving you some clues that this patient is having infection. I want you to remember that. Do not expect any direct or direct clues or direct words which says there is infection. I mean, if you get it, lucky you. Okay, if you don't, you have to be smart enough to make that connection, and that's what I want you to understand here. Make that critical thinking connection. Make that connect the dots thing which we are talking about. Whenever you see there is a patient who is on some kind of steroids, and you see that in the question or in the option they are talking about a sore throat, remember, that is a sign of infection. If they are talking about high temperature or a fever, okay, it is infection. If they are talking about some kind of redness or swelling in somewhere in the body, infection. If they are thinking about or talking about some kind of discharge coming out, pus coming out on a wound or somewhere, or they are having a UTI, it's infection. If somebody is having pain, in local pain, swelling or pain, maybe it's infection. So I want you to remember these key words, which is going to give you a clue in your question, and you have to think about, okay, there is a chance of infection. And I know that corticosteroids, the number one thing I need to remember about corticosteroid is immunosuppression. And when somebody is immunosuppressive, that means they are prone to infection, and infection can kill people. So it's my priority. Now remember, you are going to get priority questions. Expect that. And we need that, because that means those are good questions. You're going to pass the exam if you get a lot of priority questions. So how do you tackle it? Look for what is going to kill my patient. Infection can kill. Okay, so in a long-term corticosteroid therapy patient, or any immunosuppressive patient for that matter, somebody with HIV, somebody who is getting chemo, somebody who is getting radiation, somebody who is on long-term corticosteroids are immunosuppressive. So if there is any clue for you in the question or option regarding an infection, it is going to be your priority. You have to do something about it. Okay, remember that. Now, next thing, no live vaccines. We talked about it in many occasions. You will hear me talking about no live vaccines to immunosuppressive people in many of the lectures. And I think once you complete the course, you will be like, oh my gosh, she talks about this no live vaccine so many times. But I still want to say it again here. No live vaccine for anybody who is immunosuppressive. Now, what are the live vaccines? I want you to remember this. Varicella zoster. Okay, varicella zoster vaccination is a live vaccine. MMR, your measles, mumps, rubella. Okay, so that is a live vaccine. Rotavirus is live vaccine. Yellow fever vaccine is live vaccine. Flu vaccine, not the flu shot. Flu shot is okay. It is a killed vaccine. But when you get the nasal spray, flu vaccine, every season we take flu vaccine, right? Like now it is the season for flus now from October to March in America. We do take flu shot or flu vaccine, and there are two kinds available. One is the shot, okay, which is killed vaccine, which is okay, but the nasal spray is live vaccine. So do not give nasal spray flu shot, flu vaccine to somebody who's immunosuppressive. It's a live vaccine. Now, why are we not giving live vaccine? Because they are immunosuppressive. They can pick up those live vaccines and their body may not be good enough to fight it. So they might develop the infection, rather than preventing it. Okay. It's very, very important to remember these vaccines. Okay. So what is yellow fever? That's a communicable disease. Okay, that's a communicable disease which is prevalent. So there is a vaccine which can be given for yellow fever. So you get yellow fever vaccine for that. Okay. TB skin test. That's another thing to remember. TB skin test. We always talk about how we read the induration of the TB skin test. If you give the if you give that the PPD or Montos test, the intradermal test, if you give it here or somewhere in the forum, usually we give it in the forum, and we read the, how many millimeters are there in that induration, right? So that is, if there is no risk factors, absolutely no risk factors, then 15 millimeters is what we consider to be normal. Okay, if there is at least one risk factor, like you are from a developing country like India or Philippines, or you are from most of the Asian countries are considered to be developing countries, or if you work in a healthcare setting because you are so much exposed to people with infection, or if you are a nursing home resident, or if you travel too much, to other people, or something like that, or if you have comorbidities, like you have other disease conditions, then you become low risk, okay, and then it becomes 10 millimeter is our induration. Now, if you want to know more about this, listen to the respiratory lecture, okay, we talk about TB there. But in case there is an immunosuppressive patient, like a patient with steroids or patient who is on steroids, remember, we are not taking 10 as normal. We are taking 5 millimeter as normal. The moment the induration, the diameter exceeds the 5 millimeter mark, you are going to consider this patient as TB test positive. Now remember, it's not active TB positive, it's the TB test, skin test is considered to be positive. Okay, for 5, because they are immunosuppressive. Now there are certain cases where patient has something called latent TB, which means they had the exposure, they have it, but they are not showing any symptoms. And when you start these patients on steroids, and once they become immunosuppressive, they get that disease back, and they have active disease afterwards. Because now their body is immunosuppressive, it's not fighting that much. The things which were sleeping is now getting up because they can fight now, So that's why you have to be very careful when you give long-term steroids to people, because if they had some kind of disease condition, it might just flare up because now they are immunosuppressive. Okay, see, so many things to remember and connect when you are giving this medicine. Now, that's why I said it's always better to group them together. Now, these things are applicable to any medication which comes under steroids. Okay, so just remember those names which we talked about and what are the things you should be looking for. And GI bleed is another thing. Like GI bleed, we talked about, look for the dark tarry stool and look for the orthostatic vital signs, because when somebody is bleeding, one way to know is, or one thing patients usually report is feeling dizzy when they get up. They might tell you that, oh, I feel dizzy when I get up. Okay, and when I change position, I feel very dizzy. I have to sit down. I mean, that is orthostatic hypotension. And when do you get orthostatic hypotension? I mean, it is very common to have with people with anemia because there is not enough oxygenation, And when you check the hemoglobin level, sure, they are anemic. But because they are losing it through the GI system, through the stool, nobody knows about it. Okay, nobody kind of recognizes that. Make sense? Okay, so these are the major things you need to remember about corticosteroids, and you can group all the medications into that. So remember your prednisone, your betamethasone, hydrocortisone, and fluticasone. I mean, if you see any of these zones and you remember that, oh, this is a steroid, you will get the answer right. Okay, just have to connect the dots and think about it. Okay. Now we are going to go into the non-steroidal anti-inflammatory drugs, and like we already said, steroids are really good with inflammation. They are the best anti-inflammatory drugs, steroids. But like you just saw, there is a lot of problems associated with steroids. So we can use a non-steroidal anti-inflammatory drug. And in that group, the major ones, and I at least wanted to remember these 5: ibuprofen, indomethacin, ketorolac. Okay, this is something I added recently, so please remember that too. Ketorolac, naproxen, and celecoxib. There is one more we usually say, diclofenac, but it seems like in America, diclofenac is not that popular. Okay. So you may not get much of the question on diclofenac, but these are very popular NSAIDs in America, and I'm not exactly sure about Canada. It may be, maybe it's another name, but these are the generic name, and you should know this because in NCLEX this is going to come. Okay, so whether you are in America or Canada, NCLEX RN is going to be the same for you, so you are going to see this. All right, so remember these names: ibuprofen, indomethacin, ketorolac, naproxen, and celecoxib. Please remember these 5 minimum. Okay, and these medications are grouped into something called non-steroidal anti-inflammatory drugs. Okay, it's written there in the. Jerin, can you see the PowerPoint? Because the PowerPoint has all the information which I'm talking about. Okay, so these are the medications, and you will be able to. You can see that, right? Or are you just listening to me? Can you see the PowerPoint, Jerin? Just making sure. Can you see the slides which I'm showing you here? If you cannot, just let me know. And but by the way, you will be okay. You can okay. People can see it, right? Okay. All right. Just making sure that you are not just listening to me. You can see the PowerPoint slides too, right? It's very important. Okay. All right. So it is written there in the PowerPoint slides. Okay. All right. And NSAIDs are usually used as antipyretic and analgesics, right? We usually use it for ibuprofen. Just think about ibuprofen. We use it as a pain medicine, and mostly we use it as a pain medicine, but it can also reduce fever. So you have 2 uses for that. So antipyretic and analgesics are the major use of NSAIDs. So whenever you get those questions where somebody is in pain or somebody is having fever and you see that there is an NSAID being used, think about it. Okay, because 2 major issues: nephrotoxic and GI bleed. Nephrotoxic, GI bleed. Okay, remember these 2. Now, GI bleed, now you understood, it's just like the corticosteroids. We don't want GI bleed, we don't want ulcers, so we have to make sure you give this medicine with food. So we already talked about that in steroids. It's the same way. Any medicine which can cause GI upset, any medicine which can cause GI bleed, always give it with food. So that way it's not going to irritate the gastric mucosa. Okay, so that's the major side effect. The next one I wanted to remember is it is nephrotoxic. Remember, N starts with N, so N for nephro, N for nephrotoxic. It's kidneys toxic, right? It's really bad for the kidney. NSAID, N for nephrotoxic, okay? And also GI bleed, the steroids and the NSAID, even though it is non-steroidal, both of them are, really bad for the GI system. Okay, so when something is nephrotoxic, just remember what are the things you should be considering if somebody is nephrotoxic. If something is nephrotoxic, just ask yourself, if I know this drug is bad for the kidney, what should I do? What should I tell the patient? What are the things I should be proactively doing? Okay, just think about it. Okay. Number one is you don't want to give it to someone who has kidney problem, right? If somebody's creatinine is high, or somebody's blood urine nitrogen is high, or if somebody is having renal failure, try to avoid NSAIDs because you know they are kidney toxic. You know they are nephrotoxic. So you don't want to give it, right? I mean, you have to come up with some other alternatives. If you just wanted to give this ibuprofen because somebody is having fever, you can always give acetaminophen, right? You can give Tylenol because those are not nephrotoxic. They are liver toxic. Yes, you're going to, instead of kidney, it's going to affect the liver, but at least, you have alternatives, right? And for analgesic too, you have other medications which you can use if somebody is having pain and they have kidney problem. Okay, yeah, you have to. And then another thing, so how do you know? You might want to do a KFT or kidney function test, or like Rinsha says, it's also called RFT, which is renal function test. So those are the things which can cause a problem. Okay. Now the other thing about NSAID is in nephrotoxic. You want to make sure that they take enough fluids, that they take enough water or oral intake, fluid intake, because you really want to flush it out because it's cleared by the kidney and you don't want these medicines to stay in the kidney. Okay, so it's very important for you to keep that, make sure that, okay, this medicine, if somebody is taking this medicine and I know it's nephrotoxic, I need to make sure that this is getting cleared from the system. Okay. Shiba, I think nobody else is having a problem, so I guess it's a local problem for you. Just check your computer. Maybe that's why you cannot hear. Okay. Do not take two NSAIDs together. That's another thing, because if you are giving something which is a problem for the kidney, you don't want to give the same kind of medicine again. Okay. So those don't combine two medications together, which is of really bad issue for kidney. So if you're giving ibuprofen for something, don't give naproxen together. Okay, don't give something like ketorolac IV and then indomethacin PO, because both of them belong to the same group of medicine. Okay, so very important to remember that. Okay. Now the next thing we are going to do, go ahead and do into do a question together, so we can apply some of this which we just learned. We can apply that here. So the nurse is caring for a 9-year-old boy diagnosed with autoimmune disorder who will be discharged soon on steroids. Okay, they are caring for a 9-year-old boy diagnosed with autoimmune disorder who will be discharged soon on steroids. Which statement by the parent indicates the need for reinforcement of teaching? So it's about which statement by the parent indicates the need for reinforcement of teaching. So just think about it. Are you looking for something good or are you looking for something bad? When you look for reinforcement of teaching, are you looking for something good or bad? Something bad, real good. Yeah, you're looking for something really bad. So what is something you are looking which is not good. This is what the mother or the father, just as parent, this is something the mother or the father is saying, and something which is not good. Now, your clue is here. The baby, the 9-year-old son, is diagnosed with autoimmune disorder. So, I mean, we don't know what disorder, but some kind of autoimmune disorder. And he is going to be discharged soon, which means he is going to go home, and the parents are going to take care of them, right? Take care of him. He's going to go on steroids. Now, that is your clue. Okay? So read through it. I will organize a lot of play dates to keep my child's spirits up, which means, you know about play dates when children come together and they play and they have so many, good time with playing together. So that's play dates. To keep my child's spirits up, which means, when there is a kid with autoimmune disorder, we don't know what it is. Maybe it's a heart problem. Maybe it's a muscle problem. Maybe it's an arthritis problem. Maybe it's SLA. I mean, we don't know what it is, but the baby, this boy is having some disease condition, and he may not be able to, play a lot. He may not be able to go to the school. Maybe he missed a lot of school timings. So maybe he is feeling really sad that he is not able to be with his friends a lot. So the mother is coming up with, reasons to. Kulvinder, just stay with me. We are still going through the options. So remember, don't jump into conclusions. Don't jump into answers. Okay, read everything real good, and I will give you the poll and use your poll. Do not write anything in the chat window. Okay, because other people can see it. I haven't hidden the chats, and I don't want anybody to see what your answer is. Okay, all right, and don't jump into conclusions. Listen, this is a one major mistake people do. All right, never do that. Okay, so it talks about play dates to keep my child's spirits up, which means she just wants to make sure that there's a lot of kids coming to play together, which is psychologically it's good for the baby, right? So that's one thing. Second option is I will restrict my child's fluids if I notice swelling or weight gain. Okay, that is the second option. Third option, I will avoid adding table salt to food as it helps the whole family, which means she's going to reduce the salt intake. The last option is I will arrange for my son to have injectable flu vaccine every season. Okay, you know that there is a nasal flu vaccine like we talked about, and there is an injectable flu vaccine, right? So which of the following, which one is not good? Which is the one which the mother saying is not good? Okay, I'm going to give you the poll, and I want you to answer here. Okay, just click on the poll and click on send, and I will get the answer. All right, so let's see. Okay. So I know there are some people who cannot answer yet. Okay, Jarin, just like I said, do not write in the chat window. Okay, do not write here. Do not write answer here. That's why you have the poll. Okay, you have to use the poll. Do not write your answer in the chat window, because I don't want anybody to get persuaded with your answers, because your answer may be wrong, and I don't want anybody to think that their answer is right, okay, or wrong. All right, so what you do is you are going to click on the screen you are going to see, and then you are going to send it. Okay, that's how I know. All right, so most of the people answered it, and lots of people are saying 2, and some of them are saying it's D, some of them are saying it's C, and some of them are saying it's A. Okay. So let me ask Sani and Neetu and Rinsha, do you have any problem with connectivity? Can you hear me? You can see me and clear and hear me? Can you write it? Okay, yes, okay. So Victoria, I think it's a connection, it's a local connection at your problem, because people can hear me and see me. If you have problem, just maybe log out and log in, because sometimes it takes care of it. Okay, and I don't know if she can hear me, Victoria. It seems like a local issue to your end. Okay. Okay. Others can hear me. Okay. All right. So let's go back to the question. And some people did say A, and it says, I mean, whoever said A is the right answer, because here what you're looking for is avoiding this child to be in in a group of people with a lot of hi Gaileen. So avoiding this baby to be together with a lot of kids. You know how most of the kids have I'm not saying everybody, but most of the kids will have some kind of infection most of the time. You know, it may be a little common cold. You know, small things like that. You know, they might be picking up on some ear infection. They might be picking up on some common cold, and they may not wash their hands all the time. And they might be going to the, play areas without actually taking care of anything else. I mean, they just enjoy life, right? So there is always a chance that, there's always a chance that there is an infection which is going around when there is a lot of kids involved. Okay, it may be daycare, it may be play date, it may be festivals, it may be birthday parties, it may be a local gym for the babies. So whatever it is, whenever there's a lot of kids together, always think about infection. I'm not saying every child has infection, but when a kid is immunosuppressive and if they go into lots of kid group, there is always a chance that he's going to pick up something. Okay, so avoid those kind of places where a lot of children come together on a routine basis. Okay, so A is the answer, because we know that this baby or 9-year-old son who's treated with steroids are immunosuppressive. Talked about immunosuppression, right? That's the first thing. So they are immunosuppressive, and you don't want this baby to be with somebody who might have an infection. Okay, you don't want to take them to the hospital to visit infected or sick people. Okay, don't take them to a lot of crowded areas. Okay, so it's a very important thing to remember that the play dates are not a good idea. A lot of play dates are not a good idea. Well, you will do things to probably make sure that this 9-year-old boy is having a normal life, but don't make it into a crowded area or lots of children area all the time, because that's going to create a chance of infection. And like I said, infection can kill. Now, why it's not 2? Because we said that steroids can cause weight gain and fluid retention. And when somebody is having fluid retention, they already have a lot of fluid, you will restrict the fluid. Okay. Now, that will be depending on how much fluid retention is there or how much weight gain is there. And usually they say that if there is more than 3 pounds in a day or 5 pounds in a week, that's too much weight gain. Okay, that means it's a lot of fluid. So those will be educated to the parent so she can adjust. We are not saying that the child should be dehydrated. We are saying that she might restrict the fluid intake because now the baby is retaining fluid and the weight is increasing. This baby needs to go to the hospital to be taken care. So that's a good thing. Okay, so this is a bad thing. A is a bad thing. B is a good thing. C, I will avoid adding table salt to food as it helps the whole family. It's a good thing, because as you know, whenever there is sodium, there is higher chance that the fluid is going to stay. Right? So whenever the fluid is staying, that means it's a bad thing, right? So you want to avoid salt. Now, it's a good thing that you avoid salt for the entire family. A low salt diet is always good. So it's a good thing. C is a good thing. D, I will arrange for my son to have injectable flu vaccine. It's a good thing. He should be vaccinated because we want to avoid infection. But he should not be getting any live vaccine. An injectable flu vaccine is a killed vaccine. So it's okay. So B is good, C is good, D is good, A is bad. So the answer is A. See that? Okay, that's how you are going to think. That's how you are going to come to the answer. Now, please make sure that you read the question at least twice before you see the options. Okay, you have to understand the question. Do not jump into conclusions. And all the options, read them real carefully. Ask yourself, am I looking for something good or bad? Okay, because the one sentence or one word can change your answer. Okay, and that might be the one which is going to determine whether you are a pass or a fail. So don't give it to chances. Take the time to read. Okay, let's do one more. A client with chronic kidney disease is admitted with pneumonia and pleuritis. Which prescription will the nurse question? Okay, now again there is this way of asking yourself, am I looking for something good? Am I looking for something bad? This is a client with chronic kidney disease, is admitted with pneumonia and pleuritis. Which prescription will the nurse question? When are you going to question something? When there is something wrong. Good job, good job, good job, Rinsha, Kathy, and Sani. So that means whenever there is something wrong, you are going to question it. Good job. Yeah, now you're getting it. So which one is the bad thing here? Just don't answer it. I'm going to give you the poll. Okay, you can give it in the poll. Which one is going to be the bad one here? Okay. So is it acetaminophen 500 milligram PO every 6 hours as needed for fever? Ketorolac 15 milligram IV every 6 hours as needed for pain. Levofloxacin 500 milligram once daily. Methylprednisolone 125 milligram IV every 12 hours. Okay, here we go. Which one you think is the wrong one here? Which one you think need more clarification? Which one is the bad one? Okay, so you want to see the options once again? Here we go. Is it the patient with chronic kidney disease is admitted with pneumonia and pleuritis? These are the medicines. Which one is a bad medicine? Okay, which one this patient should not get? We talked about it. Here we go. Very good. You guys are getting it. You guys are getting it. Okay. So most of the people got the right answer, even though some people got A or D, but the right answer is B, the second one. That is the right answer. Okay. See, the clue here is chronic kidney disease. Okay. Like I said earlier, when somebody has chronic kidney disease, you don't want to give anything which is nephrotoxic. Now, which one here is nephrotoxic? Ketorolac, right? We just learned that, right? We just talked about NSAID. We said ketorolac here, and we said it's nephrotoxic. Do you give it when there is a kidney problem? No, not a good idea. Okay, so 2 is the bad choice, right? That the nurse is going to question. The nurse is going to probably ask the doctor to change it into something else. Okay, or at least do a kidney function test before giving that medication, right? Acetaminophen is okay because this patient has pneumonia and pleuritis. Pleuritis means there is going to be painful breathing. He's going to have chest pain when they breathe. So when there is pleuritis, and pain with pneumonia, acetaminophen is good. And acetaminophen is also good for fever. Here it is given for fever. Because with pneumonia, you can expect some fever, right? So it's a good thing. And acetaminophen is liver toxic, hepatotoxic. But here there is nothing which talks about hepatic problem. It talks about kidney problem. So we have to avoid the one which is nephrotoxic. And ketorolac, being an NSAID, non-steroidal anti-inflammatory drug, it is nephrotoxic. Okay? All right. Levofloxacin is an antibiotic. Well, you need antibiotic with pneumonia. And methylprednisolone is a steroid, right? And when there is lots of inflammation and pleuritis and acute pneumonia admitted, you can give, mostly you will get some kind of steroids. Okay. So you will be watching it, but, out of these 4, you can select only one. Because it's not a select all or apply question, it's only one option you can select, right? So that's going to be ketorolac. Good job. Good thinking. Okay. So now that we talked about NSAIDs, we talked about steroids. Those are the two major ones you are going to get probably with your pharmacology. We are now moving on to something else, and that is your sulfur drugs. Okay, so this is another area where people have been getting questions from the sulfur drug. So anytime you see the word sulfur in your medication, okay, and these are the common ones which are asked: sulfasalazine, and then it's called Bactrim. It's a combination medicine, and it has trimethoprim and sulfamethoxazole. These two medications come together, and that is called Bactrim. So that's one. The second is sulfasalazine. Okay, these two medications are the ones commonly asked, in NCLEX with regard to sulfur. So I want you to remember these two. Even if you don't remember the entire name, at least look into it to see if there is any sulfur written. Sulfur. Okay. So anywhere you see sulfur, I want you to really, really remember these 6 points. Okay. First is crystalluria, which means sulfur drugs, all of them are going to be bad for the kidney. They are going to get crystallized. When you usually these medicines are pure medicine, you take them. Bactrim is considered to be like an antibiotic. You take that. Sulfasalazine is something, sulfasalazine is something you take for irritable bowel disorder, or when you have colitis or Crohn's disease or irritable bowel syndrome or things like that. Colon problem, you usually take sulfasalazine. So these are the medications which are used usually, for this kind of problems. Now, when you take it by mouth, okay, it's good. It goes down and it gets absorbed from the stomach, and it is cleared from the body by kidney. Now, the problem is when it goes to kidney, it crystallizes. Okay. Now, anything which crystallizes in kidney is bad for the kidney. It is going to damage the kidney tissue. It is going to damage the nephrons. And you remember nephrons being the functional unit of kidney, right? So it is going to damage the kidney. So they are nephrotoxic. Now, how can you prevent that? You make sure that you give lots of water to these patients. So whenever they take sulfur drugs by mouth, especially whenever take this, please make sure that they are not getting dehydrated. Because if they get dehydrated, their kidney injury is going to be even higher. Because these crystals are going to stuck there, stay there, damage the kidney. They can go into kidney failure. Okay, from this medicine. Remember that. And you don't want that to happen. So you have to make sure they are not dehydrated. Got my point? Make sure they are drinking enough water. You monitor the urine output. How do you know if somebody is dehydrated? The best thing to know is urine output. And then you can check the skin turgor, you can check the oral mucous membrane to see if it is any, if there is any kind of dryness in the mucous membrane. But even before that, you can actually do your INOs, intake and output. If the urine output is less, there is dehydration, right? So that's the best thing you can monitor. Okay, so remember crystalluria, sulfur drugs, kidney problem, crystalluria. Next thing, photosensitivity. They are at risk for sunburn. So you should tell these patients to use sunscreen and avoid direct sun exposure. Okay, sulfur sun. Okay, S for sun exposure. Right, remember that. Now, sulfur can also give allergy. Some people are allergic to sulfur drugs. So if somebody is allergic to sulfur drugs, you cannot give it, okay? That's for sure for every drug, right? If somebody is allergic to that drug, you don't give that drug. So look into it to see if there is any allergy, okay? That I'm not mentioning here because that's common sense, right? If you're allergic to sulfur, you don't give sulfur drugs. Remember that, okay? Now, the next thing is, which people forget, is folic acid deficiency. Okay. Now, Sulfur drugs can cause folic acid deficiency. That's because it interferes with the absorption of folic acid. Even if you, you have some folic acid, its absorption by the body is interfered. So you have to make sure that you give some supplement. You actually take lots of things with folic acid, the foods which are rich in folate rich, vegetables, or at least take some medication like a vitamin supplement for folic acid when you are taking sulfur drugs. Okay, because if there is folic acid deficiency, we get anemia and megaloblastic anemia and stomatitis. Stomatitis means the oral mucosa is going to be like damaged. Mucositis, like you must have seen people with chemotherapy having a lot of cracked and ulcers and everything. So that's what stomatitis is. Okay, so that can happen. So you have to make sure that you give the supplementation. All right. Now another thing, life-threatening granulocytosis. Now it's not very common, but it can happen. So a granulocytosis means your white blood cells, especially the granulocytes, the leukocytes are low. Okay, leukopenia. Penia means lesser. Okay, so whenever there is leukopenia, what happens is you are very prone to get infection. And remember, infection can kill, right? Infection can kill. Okay, remember that. So if somebody is having leukopenia, if they are taking sulfur drugs, and you have to make sure you are doing the CBC. CBC is complete blood count. At least check what is the hemoglobin, what is the WBC count. Okay, it's important because you have to make sure that these patients are not getting any infection. Now remember, we talked about infection in corticosteroids, how NCLEX ask or give clues about infection, about sore throat, about a fever, about probably a redness and swelling and discharge and pain somewhere. So those are infection. Okay, so if you see that a patient who is taking sulfasalazine and they are having some kind of sore throat, you are worried because you know that this patient is at risk for leukopenia. Leukopenia, connect the dots. Leukopenia means less WBCs, meaning infection chance, meaning they should not get infected. It might be really bad for them. Okay, so you have to make that connection. That's a priority. Get that? Okay. Now, another thing is Stevens-Johnson syndrome. Now, we talk about Stevens-Johnson syndrome in our immunity area, and we talk about that in many of our webinars too. So, Stevens-Johnson syndrome is when there is a rash, and I can show you a picture. I have a picture. Yeah. Do you see that? This kind of rash, this is a drug reaction. Okay, this is Stevens-Johnson syndrome, the rashes, and you can see that that's toxic. The epidermis is coming out. It's called, this is like necrolysis. Okay, so this is like, the skin is kind of peeling off. Okay, necrotizing epithelium. So this is something which can happen with with the sulfur drug. So see, if somebody is talking about some rash coming up because of after taking this medication, you are worried because this is really bad. Okay, so those are common things about sulfur drugs and things you should be remembering. Think about the allergy. If they are allergic to sulfur, you don't give it. Crystalluria, because it can crystallize in the kidney and it can cause kidney damage. So you want to make sure you give a lot of fluid. You want to take it out. Photosensitivity, sun, sulfur, sun exposure should be minimized. Sunscreen should be used. Folic acid should be given because you don't want any anemia coming. Agranulocytosis is a problem. WBC count might go down, which means they are prone to infection. So you have to watch out to see if the patient is checking or complaining of any infection. We are worried about it, okay? And Stevens-Johnson syndrome. Got it? Okay, so let's do one question real quick. The nurse is developing teaching material for a client diagnosed with ulcerative colitis. Okay, the client will receive sulfasalazine. Okay, that's good because that's a medicine which can be used for ulcerative colitis. Which of the following instruction is included in the discharge teaching plan? Now, stay with me before you go to options, okay? Stay with me. The client is taking the medicine and we know it's a sulfur medicine. So we already have everything we talked about the sulfur. Now, why is he taking that sulfur drug? It's because he has the problem called ulcerative colitis. Okay, so if you don't know about ulcerative colitis, go back to your GI lecture and listen to it. It's a very important topic, okay? Ulcerative colitis. Which of the following instructions is included in the discharge teaching plan? So we're looking for good or bad. Which of the following is included in the discharge plan? Good or bad? Good. Okay, yeah. We are looking for something good. Something good. Good job. You know, I'm very proud of you guys. I mean, if you can make that one, selection, am I looking for good or bad? That itself is going to, is going to make you a lot more easier to make the good choice in the option. Okay, good job. Good job, Kulvinder. Good job, everybody. Okay, now go through it. Go through the option and see which one is the good one. I'm going to give you the survey. Okay, you're going to answer through the survey. A, include raw fruits, vegetables, and all grains in meals. B, discontinue medicine only after symptoms resolve. C, take folic acid supplements daily. And D, a skin rash is expected while taking this medicine. Okay, so I'm going to let you just think about it and see which is the good thing, okay, or the most important good thing, and you can answer. So let me give you that poll. Let me give you the options once again so you can go through it. So here's the options for you. Okay. So whichever ones. Good. Almost all of you got that correctly, and I'm so glad that you are understanding what I am teaching. I mean, that's awesome. So there are many people who are not answering, but try to answer. Okay, try to answer it. Okay, I think most of you are saying C, which is good, which is the right answer. C is the right answer. But why not the others? Okay, I know you got the right answer, and I'm very proud of you for getting the right answer. But I also want you to know why not the other ones. Okay, so we are going to think together here. So this is how I'm going to think, and I want you to think with me. Okay, so I'm reading the question and I'm like, okay, so this patient is taking a sulfur drug and he has ulcerative colitis. Now, what do I know about ulcerative colitis? I know it's a colon problem. Well, it's colitis, so it's an inflammation and infection of the colon. So when there is inflammation and infection of the colon is the large intestine, and I know ulcerative colitis patients have lots of bloody diarrhea. So they have, blood in stool, and that's diarrhea, bloody diarrhea all the time. So that's something which is possible. And this patient is getting sulfasalazine for that. Now, sulfasalazine is a very good medicine to treat ulcerative colitis. And I'm looking for something good I should say to the patient who is having ulcerative colitis and is on this medicine. Okay, now I got the question there. Let me go through the options. Include raw fruits, vegetables, and whole grains in meals. Okay, now I'm thinking, my focus is on this drug, and this drug is sulfur drug. Is this fruits, the raw fruits, vegetables, and whole grains have anything to do with the drug? Okay, maybe there is, I'm not sure. I mean, because I know this drug can cause anemia and stuff like that. And I know some of these, fruits and vegetables and whole grains will have, some kind of good vitamins and stuff in there. So it's a good thing. But really, it's ulcerative colitis, and ulcerative colitis causes diarrhea. So when somebody is having diarrhea, raw fruits and vegetables and whole grains are not a good thing to give because of the fiber. Yes, because of the fiber. So I think I will just pass it. Even though I'm not sure if that is helpful in salicylate, from the drug, I'm just going to pass it because for this patient, I know it's not a good option. Okay, so that's not the answer. Let me think about the second one, which is B. Discontinue the medicine only after the symptoms resolve. Now, there is something wrong with that statement. Because first of all, if somebody is having ulcerative colitis, you are supposed to keep taking the medicine so that you don't get a relapse or you don't get a flare. Okay, so I know that this medicine is not something you just stop when you feel better. You have to continue taking it even if you feel better, so that you don't get another attack of your colitis, right? So that's not a good option. So A is out, B is out. C, that makes sense because I know sulfur drugs can cause folic acid deficiency. I know sulfur drugs can create anemia problem, especially because of the folic acid stuff. So it's very good that this patient take folic acid supplements every day. So that's a good thing to do. So that looks like a good option. So I'm just going to keep it. I will still want to see if there is a better option, before I answer. So I want to go to D. Even though I think it's C, I'm still going to go through the option. So the last option says a skin rash is expected while taking this medicine. Oh, no. It's not expected. And if it, it might come, it's a complication. I'm not going to just, sit there and just let that skin rash develop. Okay. The moment I see the skin rash, the patient has to report that and stop the medicine actually, because that is really bad. It might be Stevens-Johnson syndrome. We already saw that, how bad it can happen, the peeling of the skin. So this patient is going home, and I'm giving discharge teaching. And if I don't tell them that the skin rash is not something which is good, they might see the rash and they will think, oh, that's expected. That's going to go away. I will just keep on taking. No, that's bad, right? So the answer is C. The third option is the right option. Okay. So this is how you do critical thinking, and this is what I want you to know. Now, I know we are over an hour now already, but I just want you to talk a little bit more about the sulfasalazine, because this is a drug which is very commonly asked, especially for the last couple of months. So many people got questions on this medication, so I really wanted to know this. If anybody has to leave, you can. I understand you have other engagements and you're busy, so it's okay. But let's just let's just talk about this a little bit more, okay? All right, so this is a medication for ulcerative colitis. It's an anti-inflammatory in colon. The best thing about sulfasalazine, okay, I want you to remember this too. It's a combination medicine. It has aspirin in it, okay? Remember that. Sulfasalazine has aspirin in it. It's a combination medicine. It's sulfapyridine, the first part, plus aspirin. That is sulfasalazine. Okay, so if you see anything about antiplatelet issues or something like that, just be careful, all right? Because there is some kind of aspirin there. Okay, anyway, adverse effects of sulfa, everything we learned in sulfa, common adverse effects are going to be there. And on top of that, sulfasalazine can cause hepatitis, drug-induced hepatitis. So liver can be in trouble. Patient can get anorexia, diarrhea, nausea, vomiting, which is your GI upset stuff. And in the blood, it reduces every cell. You can get anemia because of low hemoglobin. You can get thrombocytopenia. Okay, you can get granulocytosis, leukopenia. So you need blood test. You have to keep doing the blood test to make sure that these patients are not going into real bad complications. All right, because it's all about a risk versus benefits. You cannot just, because this is a real good medicine to treat ulcerative colitis. So you have to take the risk, because you don't want the patient to die from real bad bloody diarrhea. I mean, and there's a lot of perforation which can happen. There's a lot of other complications which can happen. So this medicine is really good, but it has its side effects. So it's a matter of which one am I going to do. I mean, I have to monitor the patient from complication, and I have to teach the patient to look into the complications, and so they can report it. Okay, so remember that. And the prescribed medicine should be continued even when the symptoms subside, because you want to prevent any relapse. Okay, you don't want any relapse from happening, so you want to prevent it. So very, very, very important that you actually make sure that the patient continue to take this medicine. Okay, sulfasalazine. Okay, so we are going to do one more question on this, and after this, probably we will be able to stop. But just try this with me. Okay, just one more application question. The nurse is caring for a client with an inflammatory bowel disease exacerbation. The client is taking prescribed sulfasalazine, and which finding would require a priority follow-up by the nurse? Look at the word, look at the clues, and think real good. Okay, the patient has inflammatory bowel disease exacerbation. There is that sulfur drug again, and it's a priority follow-up. Okay, which means you're looking for something which is a problem. Priority follow-up. Now, look at that. Number 1, urine with yellow-orange discoloration. 2, white blood cell count is 12,000 per millimeter cube. 3, patient has 6 bloody diarrheal stool in last 24 hours. Number 4, urine specific gravity is 1.034. Okay. Now, if you don't remember what the urine specific gravity, that's something you need to understand. You need to remember. It's in, like we always say in our on-site class, it's in page number 33 of your book, right? Okay. So look at that. Okay. Look at that notes. Remember, whenever there is a priority, so many things here will be a good answer. But you are looking for the best one. You are looking for the one which is going to prevent or make it really bad. Okay, so just look into that, because it's not a select all that apply question. It's you can select only one answer here, even though everything looks like some kind of a problem. Okay, so be very careful. All right, I'm going to give you the survey. There you go. Try, okay? And those people who are not trying, just try to answer. Just by taking an initiative to answer something like this is going to make you, remember those things, okay? I mean, you can be just an observer without doing anything, but your active participation is required for you to pass. Please remember that. So give the answer no matter what you think, right or wrong. You want the option again? Here we go. So no matter what is the answer you think, let it be wrong. It's okay. Nobody else is going to see your name. I mean, even I am not going to see your name. I just get a percentage of how many people answered what. Okay. So don't worry. Nobody is going to see. And you better make a mistake here than making it in your NCLEX. So please answer. There we go. All right, so it's kind of between C and D. Like 52% of the people answered C, the third one, and some of you, many others answered D, the fourth one, and some answered A, and some answered B. So let's go back. So most of the people said it's 3. Or C, which is patient had 6 bloody diarrheal stool in last 24 hours. And that is the most common answer. Unfortunately, that is not the right answer. Okay. So I'm going to think, and I want you to think with me. Patient has inflammatory bowel disease Exacerbation. Okay, what do I know about inflammatory bowel disease? There can be diarrhea. Okay, that's possible. That is expected outcome of inflammatory bowel disease. Now, what do you mean by exacerbation? Which means it's really bad. I mean, you're in the hospital because it's really bad disease right now. It's a relapse. It's an exacerbation. It's an acute stage. So, can somebody have 6 bloody diarrhea stool in a day if somebody is having or admitted with real bad inflammatory bowel disease? Yes, they can have that. Am I worried about it? No. Well, I am worried about it, but it's not going to kill them. That's why they're admitted for. I'm going to take care of it. Okay, that is the major thing they are admitted for. So it is expected. It is abnormal, true, but it is expected for this disease condition with exacerbation. So in NCLEX, whenever there is an expected abnormality that is not your priority, please remember that. Okay, whenever there is an abnormality, it is wrong, fine. But if it is an expected abnormality, it is not a priority. Like I said, all the options can be right, but the question is asking for priority follow-up. Okay, so 3 is not the answer. Now, how about urine with yellow-orange discoloration? I am worried about that, but I want you to remember sulfasalazine can cause some kind of kidney issues, and there can be yellow-orange discoloration. Okay, when there is yellow-orange discoloration, that means there is probably a kidney involvement. So I am worried about that. Okay, so between 3 and 1 is something I am worried about. I need to do some follow-up on that. I need to see what's going on, but it's something which is going to give me some clues. Okay, so I'm keeping it there. Now, so 1 is a better choice. I'm keeping it. The second one says white blood count is 12,000. So 12,000. What is the normal WBC count? Somewhere between 4,000 to I think 10,000 or 11,000. I mean, that's maximum. So basically 12,000 seems like maybe borderline high, right? Yeah, there we go. So 11,000 maximum. So 12,000 is like borderline high. So what did we say about the WBC count earlier? Are we worried about high WBC count, or did we say leukopenia? And when we say leukopenia, we are talking about low WBC count, right? We are talking about infection, immunosuppression. Okay, you're not talking about leukocyte, I mean, having WBCs high. No, another thing, another way of saying it. If somebody is having a real bad inflammatory bowel disease exacerbation, can there be slightly increased WBC count? Yes or no? Yes. People can have borderline high WBC count whenever they have infection, right? So is it something really bad that I'm going to take it as a priority? No. Is it expected? Yeah, maybe. Is it abnormal? Yes. But expected? Yeah. So am I worried? No. Is it my priority? No. Do you get it? Okay. So I am going to straight cut, take it away. It's not 2. It's not 3. All right. Because those things, both 2 and 3, I know there is something wrong, but it's okay. I mean, it's something which I might see in a patient with this kind of specific situation. Okay. So it's not 2 and 3. Now I'm stuck between 1 and 4. And I know 1 is not a good thing, and I know 4 is not a good thing. And why do I think 4 is not a good thing? What is the normal urine specific gravity again? Is it at least tell me, is 1.034 high or low? That's just the way I want to know. Is it high or low? Okay, Sani got it. Okay, just think about it. It's high, right? Yeah, urine specific gravity is high. Now, what does that tell you? If the urine specific gravity is high, what is the one thing which should come to your mind immediately? One problem, one very common problem. Dehydration. Good job. Dehydration. So this patient is having dehydration. This patient is already dehydrated. Now, what did we say about the sulfur drugs? The first thing, crystalluria. Remember that? Crystalluria. So we have to make sure they are not going to get dehydrated, because if they get dehydrated, their kidney is going to be damaged. Probably that's why there is some yellow-orange discoloration already. We don't know that. It may be because of some other things too. But I know for sure this patient should not be dehydrated. Okay, if somebody is taking sulfur, they should not be dehydrated. And here is something telling me exactly that they are getting dehydrated. Slightly high, so you still have a chance to do something about it. Give fluids. Okay, they are having diarrhea. I mean, they are having inflammatory disease exacerbation. They are having diarrhea. They are going to get dehydrated very easily. So you have to act on it immediately. If you don't, this patient is going to go into kidney failure. Make sense? So between 1 and 4, which one is most important? Which one is the priority? It's 4. Because if you take care of 4, you will indirectly take care of 1 too. Okay? So 4 is your answer here. Do you see how we connect the dots? That is critical thinking. Now, this you don't get just by reading books. Remember that. You have to go through the videos, do it with me, go through all the webinars to learn this. Okay? I need to I really feel like I want to hold your hand. I want to hold your hand and we have to walk through together. And I want to make sure that you're with me. At least with me here, okay? So we have to make sure that we do all the thinking before we select an answer, and always eliminate. If you're not sure, eliminate. How can this be not the answer? How can this be not the answer? Okay, and that's how you're going to pass this exam. All right, guys. So I know we are running a little, more than what we usually do, and we will continue. We will continue this, but I just wanted to tell you something today, which is very important, and I just wanted to make sure that everybody gets that. Don't let the yesterday's use up too much of today. Okay, do you know what that means? There are people who are, who didn't get it at the first try, and that's okay. Do not let your thoughts about yesterday or what happened yesterday happened. Come on, you cannot do anything about it. It's happened, right? So what we can do is, don't let that take too much of today, that you keep on thinking about what happened yesterday. Oh, I feel, oh my God, what's going to happen to me? How am I going to do that? Don't do that, because today is all what you got. You don't have yesterday. You don't know what's going to happen tomorrow. Today is all you got. Okay? So don't put all those precious time thinking about or reminiscing about what happened before. Just let that go. I know it's not easy. I know it's painful and it's frustrating, but let that go. It's not going to help you to hold on to it. Let it go. Let it go. Okay, let's do something new today. Let's do something what we can do the best today, because that's how we are going to make it work. Okay, so stay with me, and I really want to take this opportunity to wish you a very Merry Christmas. And so our next webinar is going to be on January 4th, and I will see you. It's a good new year, and it's going to be awesome, right? It's 2019 is going to be where most of you guys are going to be RNs already. All right, so just make sure you go through the entire content. You listen to the entire webinars, and especially for those of you who are going to write the exam before we meet again, please make sure that you go through the entire webinars and do the questions together, and don't assume things, okay? And please don't change your answer. Once you select an answer, stick with it. Just click it, submit it, move forward. All right? You don't have to, actually think about it again and then change it just before you go again. Don't change your answer, because so many research has been said, and it shows that people always change from the right answer to wrong answer when they change it. So don't change your answer. Okay? So, and pray. God always do wonders. Right? Pray for me too. And I really, Garlene, okay. All right, so many of you guys are going to write the exam, and I will be traveling, so I may not be available too, but I just want to wish you the very best, and the very best Christmas too. And I'm waiting to hear from you with lots of good news. All right, so keeping you in my prayers, keep me in your prayers too, and Bye bye. I'll see you. Take care.